The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. We have with us a terrific guest coming from beautiful Palm Springs, California. Always love it when we have dentists that come on the program. Dr. Jeff Scheperle, say hello.
Hello, everyone. It's nice to be here.
I want to start. We ask most of our guests this question: How'd you get involved in dentistry? How'd you become a dentist?
It's multiple things. I come from a family of generation after generation after generation of business owners, and so when I was probably like 10, 11 years old, I was realizing I had an uncle that owned a business. My grandfather owned a business that he started. And I just thought that that was something that I felt like I needed to do too. I was like, oh, I've got to be like my uncle. I've got to be like my grandfather and have my own business.
Right.
And then I was always curious about fixing things and solving things. And from a thinking style perspective, I'm a mechanical, technical, creative type person. So it just naturally fit. That is dentistry, mechanical, technical, creative. And I actually, at 10 or 11 years old, I looked in the, the World Book Encyclopedia and was reading about what it takes to be a dentist. And I was like, oh my gosh, I'm going to be old when I get done with school.
Right. Yeah. So here you are. So how long did you practice for?
26 years. Graduated in 96, did 26 years in private practice. I owned I bought my first practice a year out of dental school, and it was a small practice, and I built that up. I doubled it. And then after 9 years, sold it, relocated to Chicago, and thought I wanted to be in a group practice, but I had the ownership bug for too long, and I couldn't do it. I tried and I couldn't do it. So I bought another practice and had that for a dozen years. And sure. Great experience with both of them, completely different, significantly different style of practices. One was much more high tech and in an upper middle class area. The other was just very basic and very heavy blue collar and somewhat lower income. The lower income one was actually more profitable. If you want to look at like strictly profit margin, I maintained a 40% profit margin for 9 years. So
that's amazing. And I think that's kind of a good segue. You know, there's so many different myths. You hear these kind of numbers that are said enough times, and people actually believe that they're true, right? But they're not really true for everyone, especially in dentistry. So I know that you transitioned from private practice into coaching and consulting. Tell me what made you make that transition?
I think it's part of getting old. I crossed the 50-year mark a few years back, and you start thinking in terms of what can I pass on to other people? How can I draw on my experiences to make a difference? So instead of being chairside making a difference, I'm now going one step back and starting with the dentist to help them be better professionals, better business professionals. They're great technicians, but they need assistance in doing the business side of things and the mindset, just like you help doctors be better with their practices, make their practices better. I'm doing that. So I start with the dentist, then that has a rippling effect. As they are better, then they draw better employees, which then also draws better patients. Right. So starting to get them one step further back on the process of making a difference for people.
Yeah, it's amazing. You know, you talk about crossing that line into your 50s. I'm getting pretty close myself, but I will tell you, sometimes when I'm talking to younger people and I think about maturity, and I think, okay, when did I become kind of emotionally mature? That was probably like my mid 30s, honestly, right? When I started to, I think that's true for most people if they really admit it, but I'm shocked at the amount of things that I'm learning at my age now. And I think part of it is I just have more of a quest for learning than I ever have before. And also when kids are getting a little bit older, right? Some of the things that I used to enjoy doing, I don't, but I'm blown away by what I know now. And if I had that information 10, 15, 20 years ago, my trajectory would be completely different. But working with somebody like a coach that's been there, that's done that, can kind of change that trajectory now instead of having to wait till you're across 50 to get that information. So let me ask you, when people are coming to you with problems, concerns that are costing them a lot of money or a lot of pain or both, what do they look like today? What are some of the common calls and questions that you're getting from dentists?
It's almost like the same theme rehashed year over year over year. It's how do I stay profitable? How do I stay up to date with the best things that I like to work with? And how do I attract the patients I want? And so it's the same things. The newer component that I'm hearing about, though, is more people are talking about their debt than they were when I graduated. When I graduated, I was average for debt for my class. I had $100,000 debt. Yeah. Now I think it's about 400,000. Sure. And the technology is more expensive, but it allows you to do more things. So it's an interesting thing to have to navigate. I used a CAD system in my second practice, and I replaced one of them and got the more updated one, and that was about $150,000 for that. That in my first practice would have been possibly devastating financially because it wasn't. Sure. I didn't have a practice that was geared for that, so it was about finding the right match, right. And that takes some sifting through. It's not just you're doing dentistry; it's how do you want to do your dentistry? How do you want your workflow to go? And I think an important thing for people to do is pick one component, focus on it, really dig in and master that and learn what the obstacles are and find out if it's something that you can fix, you can master, or you need to delegate. And sure. That applies to everything in everybody's jobs. So when do you delegate? And personally, I had my first practice, there was no endodontist within a 20-minute drive. And to me personally, I was like, so what? It's 20 minutes. Well, that's not your typical consumer. So I devoted about a year and a half to endodontic continuing education. That was the only meetings I went to for a year and a half. And it's like, okay, I'm going to focus on this so it's top of mind. And I got better at it. And I got invested in more equipment, and it worked. So it's you have to do some introspection of, can you do it? Do you want to do it? What's it going to take to do it? And what's the impact financially if you do or don't do it? So it takes a lot. And sometimes an outside perspective is helpful on that.
Yeah. A couple of things come to mind. You talked a little bit about the technology piece, and the debt, I'm seeing debt sometimes $700,000-$800,000, right? So post undergrad, grad school. And, sometimes people are being a little too, we'll say, liberal in their cost of living and the things that they have while they're in school. And so I'm seeing numbers like that from time to time. But at the same time, cost of equipment has come way down, right? So, a scanner, how much was a scanner 5 years ago? 60 grand, 70 grand, something like that.
If you want to buy just the scanner, it was,
Now I think they're 15, I think there's even some on the market under 10. So, so there is some kind of balance. It's not all doom and gloom. I'm not saying that you're saying that, but certainly online, that's a lot of what we're hearing. I'm never going to make it. Well, there are some other things that are happening that are pretty awesome. Let's talk about becoming a master of one thing like you talked about. It sounds to me like this is kind of a bit of I do see practices do this where they chase money with the services that they want to offer. So they look at something like endo and they go, oh, hey, I should do this because I could bring in X, Y, Z into my practice. And they learn a little bit about it, but they never really master it. That usually means they're not going to make more money from it than they were making before. Do you agree with that?
Oh, absolutely. Yeah. And that's why I said, and still go back to, you've got to really focus on something to get, you can't master 5 things at once.
Yeah.
The same amount of, you spread that out and you miss some things. So narrow it down. Before I sold my practice in Chicago, about a year and a half before, something in that range, I bought a new, I think I spent about $6,000 on a new endo handpiece that had the apex locator built into it. And I was like, how much endo do I have to do to offset the cost of this? What I didn't expect was the level of fatigue I had at the end of those appointments was near zero.
Yeah.
Versus, oh my gosh, I just got through this challenging 3, maybe 4 canal molar and so on and so forth. I would go through those appointments. I'm like, oh my gosh, I'm ready to do another one right away. So it turned out to be, now that doesn't mean that's for everyone, but
Sure.
it was the right piece of technology for me. It made my job easier. I expanded a little bit, just a little bit, what I did versus what I referred. So it paid for itself in no time.
Yep. That makes sense to me. Let me ask you this question, and this isn't something that we prepared for at all, but you mentioned, you've owned 3 practices, correct?
Two.
Was it
I've
2
owned
or
2.
3?
Yes.
Okay. All right. So then you also worked as an associate for a small period of time, correct?
Yes.
All right. So here's a question. And again, it's not something that's prepared. I think nowadays, and kind of the changing society that we have, generational differences and what have you, I think we're going to see more and more dentists who aren't wanting to own a practice, that they want to be an associate. However, they're going to feel this peer pressure to own because it's always been that way, right? That's the goal is, hey, go into dentistry, so you can own your own practice, so you can have all this freedom and what have you. What do you say to people that are kind of on that, like, hey, I don't know if practice ownership's right for me? Besides slow down, take your time. What advice do you have for them?
That's a really tough one because you don't know it till you're in it.
Yeah.
You can ask all the questions you want, but it's not the same until you're actually in it. So I think you have to do some real soul searching on that, so to speak. You have to really think, go talk to the dentists that practice for 30 years and own their own practice. And what's the perks and what were the drawbacks that you experience? For me personally, it was like having time off always had to be scheduled so far in advance because I had a very busy practice in Chicago. So you have that as a downside, but you also have complete control over what is happening with that practice. So you don't have to answer to someone else. So it's a hard question to answer. And I think it's probably best handled by interview a bunch of dentists that have done it. Interview the ones that are in it, that are very new in it, partway through it, and all the way through it. Talk to as many. They're going to love to talk to you about these things. Yeah. People like to share their experiences.
They do. And the dental community is wonderful. It always amazes me how great the dental community is about that. Let me ask you this question. Who's the ideal candidate to work with you? Who's an ideal dentist that you would work with that you could help take their life to the next level?
That's actually I think that's fairly easy. And maybe I think it's easy to answer. It's those dentists in the first half of their career. They're still figuring things out. You will eventually, most likely, figure things out and work through the pitfalls and so on and so forth. But the earlier on in your career that you gain some wisdom, it changes your trajectory for your career. It may actually add years onto your career because you have less chance of burning out because you've got the wisdom that instead of getting that wisdom in 15 or 25 years, you got it in 5 years. Yep. So it changes that trajectory. And it's about basically understanding yourself and understanding how you want to go through your career and get some good focus on that. Dentistry is a great profession and not a match for everyone, but it takes some time to sort through those things. And I find that the people in that first 10 years particularly are very open to advice from the old people like me. So I've got a guy I worked with not too long ago. I was in a group practice here in Palm Springs briefly, just as a hobby. And one of the guys I worked with that was an associate there, he goes, I want to keep in touch with you. I want your information because I've only been practicing for 9 or 10 months, and I know eventually I'm going to need to talk to you about some more things. And so we still keep in touch because we've had a lot of conversations about where you go through your lifetime of practice and how you go about it and what makes it easier.
Right. That's awesome. I want to encourage our audience, check out your website. It's Scheperle.com. We're going to put it on the show on our YouTube and Facebook. We'll make sure we share it everywhere. I want to encourage the audience to check out your website. And if they need help, give you a call. Dr. Scheperle, thank you so much for being here. We really appreciate you.
Oh, thank you. I'm glad to be here.